my name is Christy. I'm going to be your student nurse today. We're going to go ahead and perform a head-to-toe assessment, but before we begin, I'll go ahead and provide you with some privacy. I'm going to go ahead and put the handrails up for your safety, and I'm going to go ahead and perform hand hygiene. Okay, can we start by giving me your name and date of birth, please?
Ricky Kern, December 19, 1990.
Okay, do you know where you are?
Mercy Hospital.
Do you know what time it is?
9:52.
Okay. Patient seems to be alert and oriented ×3. I'm going to go ahead and check your vital signs right now. I'm going to go ahead and use my stethoscope to auscultate for the sounds, the temperature. I'm going to go ahead and use my thermometer to go ahead and check that for you. I'm going to use a pulse oximeter to check your oxygen saturation and my blood pressure cuff to check your blood pressure, and I'm going to go ahead and use my pen light to check your pupils today. Okay, before we begin, I'll go ahead and sterilize my equipment. Okay. Vital signs came out good. The temperature came out to 98.6 degrees Fahrenheit. Your oxygen saturation was 90%. Blood pressure was 120/80. Your respirations were 18 respirations per minute, and your heart rate was at 80 beats per minute. Okay, now we're going to go ahead and begin by inspecting your head. Okay, I'm going to go ahead and inspect and palpate the head to go ahead and check for any bruises, any lesions, or lice, or anything that might be out of the ordinary. Okay, everything seems good. I'm going to make my way down to the ear. I'm going to go ahead and palpate it just to check for any redness, any tenderness, any discharge, hearing aids. Looks good. Okay. I'm going to go ahead and check your eyes. I'm going to check your conjunctiva. For mucosa, everything looks good. It's pinkish and moist. Your sclera looks white. Okay. What I'm going to go ahead and do is I'm going to go ahead and perform the Perla test on your pupils. If you can just look straight at me, please, while I shine the light. Now I'm checking to make sure that the pupils are equally round and reacting to light accommodation. Okay. I'm going to go ahead and start by inspecting your sinuses, checking for symmetry on the face. That's good. Checking for discoloration on the lips. Okay. Now I'm checking the sublingual pocket on the tongue. Everything looks good, pink and moist. The gums look healthy. All 32 teeth need to be intact. Now if you can just please sit up for me. Have the patient sit up at a 45-degree angle. You can just go ahead and turn to your right. I'm going to go ahead and check for JVD, which is the jugular vein distension, on both sides with my pen light. Okay, go ahead and lay back down. Now I'm going to go ahead and check your respiration on the thoracic region. Okay, I'm going to go ahead and lift up your shirt real quick. Okay, first I'm inspecting the thorax to check for any discoloration, any bruises, any sores. Everything seems good. I'm going to begin with palpating. Go ahead and let me know if you feel any pain. Now I'm going to go ahead and auscultate to listen to your respiration, starting at above the clavicle. Moving my way down below the clavicle. Now we're going to begin by checking your heart. I'm going to start by checking the aortic valve, which is the second intercostal space to the right of the sternum. Then it will be the pulmonary valve, which will be the second intercostal space to the left of the sternum. The tricuspid valve, which would be the fourth intercostal space to the left side of the sternum. And then it would be your mitral valve, which would be the midclavicular line, the fifth pulses space, which would be your PMI. I would go ahead and auscultate for a full minute to check for your apical pulse. If you could just please sit up for me, please, so I can check the posterior of your thoracic region. I'm going to go ahead and lift up your shirt. We're going to go ahead and check the posterior thoracic region for you. I'm going to go ahead and check your respirations. I'm going to go ahead and warm up my stethoscope first. And whenever you feel my stethoscope touch you, go ahead and take a deep breath in for me. Okay, after checking your anterior and posterior thoracic region, both your lungs sound equally clear bilaterally. There's no indications of any wheezing or any crackles. Now if you can just lean forward for me, please, so I can just check the symmetry. Take a deep breath in for me. And out. Okay, I'm going to go ahead and lift back your shirt, and we'll go ahead and check the next section of our assessment. Okay, we're going to begin the assessment on your abdomen. I have the patient laying down in a supine position so it can be easier to assess. I'm going to go ahead and lift up your shirt real quick. Okay, first I'm going to inspect the abdomen region just to make sure there's no discoloration, any scars, any bruises. I'm going to go ahead and also check for symmetry to make sure that both sides are equal. Everything's good. Okay. First, now I'm going to go ahead and auscultate to check for peristalsis or any bowel movements. Starting with the right lower quadrant, making my way up to the right upper quadrant, left upper quadrant, and the left lower quadrant. Okay. Now I'm going to go ahead and palpate. You're going to go ahead and let me know if there's any pain that you feel. Okay. I'm going to go ahead and percuss. Okay, the tympani on the both upper quadrants are dull and the lower quadrants are hollow. I'm going to go ahead and lower your shirt. Okay, now I'm going to go ahead and check the upper extremities, check the nail beds for any discoloration, any signs of cyanosis. Everything's good. Okay, to test your strength, can you go ahead and squeeze my hands for me both at the same time? Okay, that's good. Can you go ahead and move your arm up and down, please? Okay, we're checking your range of motion. Everything's good. Okay. Now we're going to begin with the lower extremities. I'm going to lift this up for you real quick. Okay. First I'm going to inspect, check for any discoloration, any bruises, any sores. Okay. I'm going to begin by checking for any edema on the feet. Everything's good. The edema would be a +1. Okay, I'm going to go ahead and check the temperature. Feels good. Now I'm going to go ahead and check for the pulse on the posterior tibialis. And both feel a strong pulse equally, bilaterally. I'm going to go ahead and check the pulse on the dorsalis pedis. They both feel equally strong bilaterally. Okay. Now we're going to go ahead and check your strength. Can you go ahead and push your feet against my hands, please? Okay, and to check your range of motion, can you just move your foot up and down? Okay, and can you just go ahead and bend your knee for me? going to go ahead and cover you back up. I'm going to go ahead and perform hand hygiene. Okay. We already finished the head to toe assessment. Since you were not a stroke patient or head trauma patient, I didn't have to perform the Glasgow Coma Scale on you today, but in case you were, I would have to go ahead and perform it. I'm going to leave the call out here for you. I'll be back in about an hour. Do you have any questions for me?
No.
No? Is there anything I can do to make you feel more comfortable?
No, thank you.
Okay, I'll go ahead and be back in about an hour. I'm going to go ahead and document my findings.